Local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState. I'm Katie, and joined with us today, we have a very special guest from Meredith Hagerstown Gastroenterology, my GI doctor as well, Dr. Choudari. How are you today?
Well, thank you. Thank you for having me.
Thanks for coming back again. And I think it's appropriate that we are doing this interview in the month of March because the month of March is Colon Cancer Awareness Month.
That is correct.
And so we're going to talk about, what risks of colon cancer and also colonoscopies in our interview today. So let me just start by asking you, Dr. Choudari, we're hearing more about early onset colon cancer. What do you think is driving the rise in cases amongst older or younger adults?
For decades, colorectal cancer was considered to be a disease of people above the age of 50 years. That is no longer the case now. The incidence of young adults between 20 to 45 is increasing at the rate of 3% per year. Early onset colorectal cancer now accounts for nearly 10% of all cases. In the next decade, it is estimated that about 25% of all rectal cancers and 10 to 12% of all colon cancers will be in this young onset people between 20 and 49.
Wow.
Why is this happening? There is no clear-cut answer to explain the growth in early onset cancer, but there are certain factors. Modifiable risk factors and non-modifiable risk factors. The modifiable risk factors are typically raising obesity, sedentary habits, lack of physical exercise, dietary choices such as high intake of red meat and processed food, smoking, and alcohol consumption.
Mm-hmm.
These are risk factors we can control. The things we can't control are the family history of colon cancer, family history of inflammatory bowel disease, or genetic syndromes such as Lynch syndrome and familial adenomatous polyposis, typically called as FAP.
And are there steps that, I guess you kind of answered my next question, but are there steps that people can do in their 20s or their 30s to reduce their risk? Exercise, eat
Sure.
right, avoid smoking.
The most important thing is know your family history. Okay. And do not dismiss persistent symptoms. If they've got change in bowel habits, sense of incomplete evacuation, diarrhea, constipation, rectal bleeding, unexplained weight loss, fatigue, which can indicate you're anemic, these are all warning signs. And if these symptoms persist, please do not ignore them. You need to seek help.
And if someone is experiencing these symptoms, what's the first step to take? Would it be to go to their regular physician and then go to a GI doctor?
Absolutely. They would go to their primary care physician and, we now start screening at age 45 or even younger if you have any of these risk factors. And clearly colonoscopy is the gold standard. So they would be referred to a gastroenterologist.
What is the difference, or I guess maybe the benefit of a colonoscopy versus, how you can do the boxes and send it away and they'll do that kind of, I don't know what the word is for that, but what's
the test you're referring to is called Cologuard test.
Cologuard.
It is a stool DNA based test. Those tests, personally don't order those tests because they've got a lot of false positives and false negatives. And those tests are aimed to identify cancer. Whereas colonoscopy, we identify precancerous lesions and get them out before they turn into cancer. So there's a big difference between a box test and colonoscopy.
Mm-hmm.
I think if somebody is fit and healthy, walking and talking, they should have a colonoscopy.
Mm-hmm. And this will lead us into the next part here. I think when people, that when they think colonoscopy, there's a nervousness that's associated with it and a hesitation. What would you say to somebody who has to get a colonoscopy, but they are feeling nervous or hesitant about it?
Well, let me put it this way. You had a colonoscopy recently. Okay?
Absolutely.
Can I ask, I mean, how did you feel about the prep? Where did you have it done? And what did you think about it?
Well, I'll tell you, Dr. Chaudhry, and then a little. Dr. Chaudhry and I have some history. I have been going to see Dr. Chaudhry since I was in my mid-20s. I had a horrible case of diverticulitis, and ever since then, every few years, I go and get a colonoscopy. And most recently, it was, I mean, not even a month ago, I was in there, and it is such. The colonoscopy is nothing. It's absolutely nothing, and the prep has come so far. I remember the first time compared to when I just went a couple weeks ago, there used to be a lot more pills and different drinks that I had to do. Now it was just one thing, one jug, half of it, the other half, some Gas X pills, and that was it. I mean, it really is not anything that is scary. I don't think so.
Absolutely. And I think patients are realizing that as well. The old days, the preps were difficult. It's much more easier now.
Yes.
And if people can't drink all that liquid, there are pills we can use as well.
And I think that the one thing I love about your facility is that you guys called me a few times to check in to make sure everything was going okay. And I did have a couple questions because when you start drinking the liquid and taking the pills, it might take some people a little bit longer for it to kick in, so to speak. And I know that can cause a little bit of concern. Is everything okay? Am I doing this okay? And your office, I just love you and your office, called to just check in on me. And I asked that question and they were like, oh, yeah, that's normal. If by 3 a.m. something's not moving, give us a call back. But it was just easy. There is anesthesia involved. And how long does the whole colonoscopy take? Is it 20 minutes?
Anywhere between 20 to 40 minutes, depending on what you find. If you have polyps, it does take much longer. Generally between 20 to 40, 45 minutes.
And then when you come out of the anesthesia, I'm assuming a quick talk with the doctor, a follow-up. Are you able to, when you do the colonoscopy, are you able to immediately take care of polyps if you see them?
Absolutely. Yeah. That's the idea. So if you find any polyps, 95% of the time we can remove the polyps. But if the polyps are very huge or very flat, then we may have to come back or send them to another facility to have them done.
And when you do your colonoscopy, what exactly are you looking for? Like what is something that you might see that you would think we gotta check in on that and see what's going on there?
You look for polyps, look for cancer, obviously. And we do colonoscopy for other variety of reasons, like for inflammatory bowel disease, other forms of colitis. People come in with rectal bleeding, abdominal pain, weight loss. And you might find things other than polyps where you have to take biopsies to make a diagnosis.
And I think that, we talked about this last year too. It can be uncomfortable to talk about these things, but if you are noticing a change in your bowel habits or, obviously rectal bleeding is a huge one, don't put it off. You have to get it checked out.
Yeah, I mean, and that is particularly important for young patients. For somebody in their 20s and 30s, both patients and probably some of their physicians as well, we just ignore them. I mean, you're in your 20s, I can't possibly have cancer. Okay. And people put things off, and my response to that is, if you have symptoms which persist and don't go away, you got to see your doctor.
Absolutely. Absolutely. And it's so scary to think about how much more we're seeing it. And also hearing about it. I know celebrity deaths, we're hearing more and more about colon cancer and taking lives in Hollywood. Nobody is what's the word I'm looking for? Safe from it. You know what I mean? Yeah.
Absolutely. Diagnosis of colorectal cancer in young adults is devastating. Can be life-changing. It's incredibly taxing from an emotional, physical, and financial standpoint. When you see young people with colon cancer, it's a devastating illness.
Absolutely. Can you explain to me a little bit colitis?
Colitis is inflammation of the colon. The most common colitis which we talk about are Crohn's disease, ulcerative colitis. There are a number of other forms of colitis. You can have microscopic colitis, you can have C. diff colitis. So colitis is a general term which just means there's inflammation of the colon. It could be infection related, it could be inflammatory related, it could be other things as well.
And is colitis something that's manageable? Is something that you can take some kind of medication to assist with that?
Absolutely. All forms of colitis are easily treatable. Yeah.
Okay. Well, and before we wrap up here, Dr. Choudari, I just want to say on a personal note, I just adore you, and I just think I think the world of you and your facility. And Dr. Choudari, how long have you been doing this?
About 3 decades now.
I was going to say, I mean, there's nobody, I can't imagine anybody any more knowledgeable in the area than you. And you look just like Albert Einstein.
Thank you.
And equally as smart, in my opinion.
I wish I had 5% of his brain.
Well, Dr. Choudari, we really do. I know you are a very busy man, and you have a lot of patients. And I really do appreciate you taking the time to talk to us. It is really important that we spread the word about colon cancer and how easy colonoscopies have become, and just let people know it. If something feels off, if something is wrong, don't put it off. Go and get it checked out.
Absolutely. You got that right, Katie.
Yes. I mean, peace of mind as well, just to know, okay, that's everything's good. Okay. I can keep moving on. But coming from someone who has had multiple colonoscopies, it is an easy process. Dr. Choudari is incredible. And, thank you again, Dr. Choudari, for spending some time with us on Let's Talk TriState.
Let's talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.